Is Parkinson's a preventable disease? And if it is, what should each of us do to avoid getting it? The co-author of a provocative book is here to answer those questions.
And I think for people who have been diagnosed with Parkinson's, one of the first things they should be advised to do is stop getting exposed to chemicals in their food, water, and air that are likely contributing to the disease. So in the end of the book, on page 237, we give readers the Parkinson's 25 actions they can take in their everyday life to possibly slow the rate of progression of the disease.
Our guest is Dr. Ray Dorsey, a neurologist and a researcher. The book is titled The Parkinson's Plan.
This is what trichloroethylene looks like. It's got a whopping 6 atoms, 2 carbons in black, 1 hydrogen in white, 3 chlorine atoms in blue. It's got a cousin named perchloroethylene that's still widely used. That's one report I saw says that 60 to 70% of dry cleaners in the United States still use perchloroethylene. In a twin study done by Dr. Tanner and her colleague, Dr. Sam Goldman, they found about a 500% increased risk for using Parkinson's among people who had exposure to these chemicals used in dry cleaning.
This is Conversations on Healthcare.
Dr. Dorsey, welcome to Conversations on Healthcare.
Thank you very much, Mark and Margaret. Everyone calls me Ray.
Okay,
Ray, that's
good.
Great. Well, let's start with an overview for our audience of Parkinson's, which is the world's fastest growing neurodegenerative disease. It affects over 1 million Americans and is the 13th leading cause of death in our country. Dr. Dorsey, what have healthcare providers typically thought causes Parkinson's disease?
If you read the textbook, it says that Parkinson's disease, and what I was taught in medical school, some function of aging, interactions between the gene and the environment, and maybe a word about pesticides. And I largely think what I've been told is wrong. I think the principal causes of Parkinson's disease have little to do with aging. If you put a mouse in the laboratory and let it age, it will never spontaneously develop Parkinson's disease. The only way that mouse will develop Parkinson's disease if you manipulate its genes or expose it to toxic chemicals. And only less than 15% of Americans and less than 15% of people worldwide carry a genetic cause or genetic risk factor for the disease. So the principal causes of Parkinson's disease do not lie within us. They're not in our DNA. They're outside of us. They're in our environment. Chemicals in our food, chemicals in our water, and chemicals in our air.
Well, that takes us really, I think, to the heart of your work and our interest in talking today. You're basically saying point blank Parkinson's is preventable and that over 85% of patients with Parkinson's do not carry a genetic cause or risk factor. So preventable is a strong and, a hopeful word. Your confidence on this comes from your research, current evidence. Tell us more.
The confidence comes from a woman, Dr. Caroline Tanner, who, like me, is a Parkinson's specialist, but has a PhD in epidemiology. And she quietly, diligently has been telling us for 40 years that the principal causes of Parkinson's disease are not genetic, but are environmental. And she's done that through a twin study in 1999 when she looked at the rates of Parkinson's disease among identical twins and compared it to fraternal twins. If something's very strongly genetic, it will be much more common among identical twins than it will be shared than among fraternal twins. But she found no difference, suggesting that the principal causes of Parkinson's disease do not lie in our genes, but in our environment. And then she has identified industrial risk factors in China. She's shown that exposure to a weed killer called paraquat is associated with 150% increased risk of the disease among farmers. She showed that veterans who served at Camp Lejeune, which was contaminated with a dry cleaning or degreasing chemical called trichloroethylene, have a 70% increased risk of developing Parkinson's disease. And she's been telling this for 40 years, and we just haven't been listening to her. And once I had the gift of a sabbatical in about 2018, I read much of her work, and I came away wondering why I hadn't been taught this and why I didn't know it. And now that I've read it all and spoken to hundreds of people with Parkinson's and done our own research studies, I'm increasingly convinced that for the vast majority of us, Parkinson's is a disease.
Well, I want to pull the thread on the thought that it's chemical or environmental. You have a paper in the Journal of the American Medical Association Network. In it, you write that if you live within 1 to 3 miles of a golf course, you increase your risk to Parkinson's dramatically. Why did you reach this conclusion? How did you get there?
Yeah, so the credit goes to my colleagues, Dr. Brittany Krasnowski, a geographer who now works at the Atria Health and Research Institute with me, and Dr. Rodolfo Savica, a neurologist at the Mayo Clinic in Rochester, Minnesota. And what they found was that individuals who live within a mile of a golf course, and golf courses can use up to 80 times as much pesticides per acre as farmland, the individuals who live within a mile of a golf course have a 126% increased risk of developing Parkinson's disease. And they really focused on the water supply to these individuals. I get really concerned that people might be inhaling the pesticides that are sprayed on golf courses. But nonetheless, the research showed that people living within a mile of a golf course had more than a doubled risk of Parkinson's disease. And this just adds to the evidence that exposure to certain pesticides, including that sprayed on golf courses, those sprayed on corn and soybean fields across the country, are at high risk for developing the disease. It shouldn't be that much of a surprise, given that many pesticides are designed to kill or damage the nervous system of insects. And if you give someone a chemical that's damaging the nervous system of insects, it shouldn't be surprised that it might have untoward effects on the nervous system of us.
Is it the paraquat or is it a different chemical in the golf courses?
The golf courses that we didn't identify the specific chemicals. My understanding is that paraquat has been banned to use on golf courses, although that research looked back at people's exposure in 10 years before diagnosis. 2 pesticides that are commonly used on golf courses are concerning. One is called 2,4-D. It's actually a component of Agent Orange, which separately has been linked to Parkinson's disease. And another is a pesticide called chlorpyrifos, widely sprayed on apple orchards and golf courses. The EPA, because of safety reasons, because it's been associated with the loss of 16 million IQ points among 26 million American children, banned it in 2021. But the manufacturer successfully sued to overturn that ban. It's allowed, again, depending on the state, to be sprayed on apple orchards and I think on golf courses as well.
Is there a disproportionate number of people with Parkinson's who are long-term golfers?
That has been studied to my knowledge. There are actually 3 studies that link green space workers, landscapers, people who work on golf courses to the disease. In our book, we tell the story of a young boy who lived next to the 13th hole of a golf course in Charlotte, North Carolina. Growing up as a young teenager, he worked on the sod squad, repairing divots on the golf course. At age 17, his parents are telling him to sit up straight. He then develops a tremor in his left leg and is diagnosed with Parkinson's disease at age 23. Mm-hmm. I just think if you look and you listen and you observe and you think, you really come to the conclusion that indiscriminate use of pesticides, many of which are neurotoxins, are having profound impact on our brain health. And Parkinson's is just one example of diseases that is affecting individuals.
Well, it's one example, but it is such a high frequency disease at this point. And I wonder if you could share with us how the government has responded, particularly to the fact that we have this kind of very large cohort of people who were at Camp Lejeune, high numbers of cases. Are we taking advantage of the sad opportunity to look at longitudinal studies, to look at treatment options? We have kind of a natural ability to look at control groups, similar service people on different bases. What have we done with this really critical insight into that high incidence at Camp Lejeune to try and further prevention and also treatment and knowledge of the disorder?
Yeah, I mean, so if Parkinson's is largely a man-made disease, then humans can end it. And diseases are not permanent fixtures of human society. Diseases come and go. Infectious diseases largely didn't come until about 10,000 years ago when we had the agrarian revolution that brought humans in close contact with one another. And we now live in a world that's largely free of polio. We live in a world where yellow fever and smallpox, smallpox doesn't exist. Yellow fever is really rare. Few people are dying of typhus. So diseases aren't permanent fixtures. If we change our environment, we can get rid of these diseases. In 2024, the EPA banned trichloroethylene and perchloroethylene, the chemicals that contaminated the marine base Camp Lejeune. If we do that and that ban goes through, parts of it appear to have been frozen in 2025. But if we put that ban through, future generations cheer because they're spared the indignities of Parkinson's disease, and trichloroethylene is known to cause cancer. So we prevent people from ever getting cancer. The EPA administrator, Lee Zeldin, tweeted out about a couple of weeks ago that the EPA is re-examining the authorization to use paraquat. Over 70 countries, including China, have banned this weed killer, but the weed killer is sprayed on farms throughout the United States and in increasing amounts. If the EPA indeed re-examines it and removes paraquat, we prevent future farmers, future people who simply live or work near where paraquat is sprayed, likely from ever developing these terrible conditions.
Well, I don't think
within our control.
Right. I don't think there's be a surprise that there's been pushback from the chemical industry. Spokespeople say there's been a rush to judgment and that some large studies don't really back up your contention. What's your response to their claim?
Well, trichloroethylene's been around since the 1920s. I think a century of causing cancer is long enough. I don't think we're rushing anywhere. Paraquat's been used in the United States, I think, since 1963. 60 years of a weed killer that laboratory reproduces the features of Parkinson's disease, including tremor, that according to the reporting from The Guardian, a manufacturer of paraquat had exposed 3 different mammals, mice, rats, and rabbits, to paraquat and showed it reproduced the features of the disease, including tremor, shaking of the paw. They did these experiments in the 1960s, 30 years before academics had done the same experiments. I don't think we're rushing to judgment at all. I think we should be asking chemical companies, why haven't they long since introduced safer alternatives to prevent us from developing Parkinson's and cancer?
Well, Ray, let's move on to what happens after an individual receives a Parkinson's diagnosis. Your book talks about new treatments, ways to help people. Please take us through the approaches that are being used now.
Yeah, so if Parkinson's is due to chemicals in our environment, then perhaps the first thing that individuals who have the disease should do is stop getting exposed to these chemicals. So it's akin to a smoker who gets diagnosed with lung cancer. What's the first thing the doctor is going to tell him to do? Stop smoking. And indeed, if you stop smoking, your progression of lung cancer decreases. And I think for people who have been diagnosed with Parkinson's, one of the first things they should be advised to do is stop getting exposed to chemicals in their food, water, and air that are likely contributing to the disease. So in the end of the book, on page 237, we give readers the Parkinson's 25 actions they can take in their everyday life to possibly slow the rate of progression of the disease. Wash your fruits and vegetables, even your organic ones, with water and perhaps a vegetable wash or a salt solution. Use an air purifier, add a water filter to your faucet at home. Check your well if you're drinking, if you get your water from a well. And these things also might reduce the risk of ever developing the disease. So there are a bunch of action items that we give in the back of the book. People can jump to it. If they want the Reader's Digest version of the book, they can go to 237, lots of pictures and very short descriptions of actions people can take in their everyday life to slow the disease or to give their children and grandchildren lives free of this terrible disease.
Dr. Dorsey, Ray, I think our audience would be interested in your journey to becoming a Parkinson's specialist. How did you find yourself attracted to this disease and the cause?
Both my parents are psychiatrists, so I like to say I rebelled and I became a neurologist. And then I had a wonderful grandmother, and I've always enjoyed caring for older individuals. And in residency during neurological training, I found that individuals with Parkinson's, it's really based on listening to them, observing them, and you could make them better. And then only later did I really find out what I think are the underlying causes of the disease. And I can't think of a greater duty, a greater responsibility than a neurologist has than to create a world without that disease. You know, my predecessors have created a world largely free of polio. I was speaking to Dr. Justin MacArthur, who's the chair of neurology at Johns Hopkins, and he's been caring for people with neurological complications of HIV for the last 30 years. And he says he might be going out of business because the incidence of HIV, because we're preventing it and treating it effectively, is at its lowest level since 1990.
Right.
And neurological complications of the disease are increasingly rare. I think we can create a world without where Parkinson's is increasingly rare instead of increasingly common. I think we can do the same thing for ALS. I think we can do the same thing for Alzheimer's disease. I think we can do the same thing for autism. We should just not delay. We should prevent these brain diseases now, and we should slow the rate of progression for these individuals already affected today.
I'd like to just sort of to use as an example one thing from your list there to really convey to our listeners the sense of how broad these are. I think people actually have heard quite a bit about the golf course phenomena and the pesticides, but you have on your list even dry cleaning. Most of us sooner or later go to the dry cleaners. What do we do when we receive the clothes back from the dry cleaner that you think helps protect us?
Yeah, so who knew? And
Not me.
This is what trichloroethylene looks like. It's got a whopping 6 atoms, 2 carbons in black, 1 hydrogen in white, 3 chlorine atoms in blue. It's got a cousin named perchloroethylene that's still widely used. That one report I saw says that 60 to 70% of dry cleaners in the United States still use perchloroethylene. In a twin study done by Dr. Tanner and her colleague, Dr. Sam Goldman, they found about a 500% increased risk for using Parkinson's among people who had exposure to these chemicals used in dry cleaning. So get a green dry cleaner, use a dry cleaner that does not use perchloroethylene called PERC. And then if you do use a dry cleaner and are getting exposed to perchloroethylene, take the bag off your dry cleaning and let it air out, perhaps in the garage, perhaps outside, because you don't want the dry clean clothes to be releasing the gas into your home, and then you're breathing it in your closet, in your bedroom, and the like. We're just paying a really, 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 really high price so our clothes don't shrink.
That would sort of, if I could just ask a quick follow-up question, it would sort of suggest that an appropriate group to study might be people who work in the dry cleaning industry. Have there been studies that really look at that occupational group?
Yeah, so there's to my knowledge, one tiny study done in Denmark, and they looked at various occupation journalists, accountants, retail clerks, farmers, and the job occupation that they found that had the highest risk of developing Parkinson's disease was female dry cleaning workers, who had a 1,500%, like 15-fold increased risk of developing Parkinson's.
You know, we've been talking about the causes of Parkinson. Are there any solutions out there? I know we've had a lot of shows around CRISPR technology, and I'm wondering if you see anything on the horizon around gene editing or gene therapy. Is there any hope for patients?
Yeah, so there's lots of hopes. In chapters 8 and 9 of the book, my colleague and co-author, Dr. Michael Oken, takes us through what are the most promising treatments in the short term, next 5 years, midterm, 5 to 10 years, and long term. And that includes some gene editing. It includes gene-directed therapies for about 15% of people who carry a genetic risk factor. Some of these might also apply to environmental causes, because it looks like the environmental causes of Parkinson's in many ways replicate the biology of the genetic forms of the disease. We also look at antibodies that could prevent the spread of this misfolded protein that's present in Parkinson's, just like we have antibodies to clear out the misfolded protein in Alzheimer's disease. Similar approaches might work for individuals with Parkinson's disease. But I think in the United States, and medical training is that we want to go from disease to treatment. And what our book is really trying to do is go from disease to cause. If you figure out what the cause of disease is, you can prevent people from ever getting it. We can't cure polio even today. There are no polio treatment centers in the United States. We just have a world without polio. And we've done the same thing for yellow fever. We've done the same thing for smallpox. There's no cure for smallpox. You just don't get smallpox. No cure for measles. You just don't get measles. And I think you can do the same thing.
You get a vaccine on those. Is there a vaccine?
You get a vaccine, but I'll give you another one. Cancer of the scrotum. So in the 1700s, young men in their 20s and 30s were appearing before Percival Pott, a British surgeon, and he was resecting these tumors on the scrotum of these young men, doing increasingly invasive surgeries. And whatever he did, the cancer came back and they would die. And he was wondering what was causing the cancer of the scrotum. And then he listened. He listened to all these young men, and it turned out when they were young boys, 5, 8, 10 years old, they had all worked as chimney sweeps in 18th century England, think Charles Dickens, and they were using their small, flexible bodies to clean out the chimneys. And you can imagine the chimneys filled with carcinogens, soot that was getting into the sac around their testes and causing cancer. He figured this out. Eventually, Britain bans the use of young boys as chimney sweeps. And today you have a better chance of getting struck by lightning than you do of getting cancer of the scrotum.
Well, Ray, I understand you've reviewed the Make America Healthy Again plan from Robert F. Kennedy Jr., and you've noted that you see some signs of optimism. Is that right? Comment on that?
There are two reports that I'm aware of. It's a diagnostic report, identified pesticides as a contributor to the rise of chronic conditions among children. I found in the course of writing this book that we routinely spread pesticides, many of which are nerve toxins, on kids' schools and playgrounds, and we wonder why 1 in 31 American children have autism. I think the action plan could have gone a lot farther in terms of taking actions to ban these chemicals, to reduce their use, to find safer alternatives. So I think I think the MAHA movement, generally speaking, is right, that there is something wrong about why 1 in 31 American children have autism, why Parkinson's is one of the world's fastest growing brain diseases, why 1 in 3 Americans who reach 85 will develop Alzheimer's disease. These are all unnatural consequences. These are not normal. These diseases, many of them, are being driven by chemicals in our food, water, and air. We get rid of these chemicals in our food, water, and air. We find safer alternatives. We use less. We create a world where these diseases are increasingly rare instead of increasingly common.
Well, let's continue the conversation about the federal government, because you're proposing that the government spend $3 billion to tackle environmental causes, boost research efforts, increase access to care, and invest in new treatment. Is that realistic when we're seeing so many federal budget cuts?
So the federal government is spending $25 billion a year in Medicare alone to care for the 1 million Americans with Parkinson's disease. The cost of Medicare of Parkinson's disease in terms of incremental healthcare costs is $25,000 per person. If we prevent 1% of Parkinson's disease, we save Medicare $25 billion. That's Medicare alone. That's not counting the financial burden to families, caregiver support, out-of-pocket expenditures, loss of disability. The threats to the budget are because we're seeing the rise of preventable diseases. If we spend 1% of the money that we're spending on caring for people with Parkinson's disease on preventing the disease, we create a world where these diseases are increasingly rare instead of increasingly common. We reduce Medicare expenditures, and we let people live longer, healthier, more productive lives.
Have you had any conversations with the administration around this issue?
No, I've reached out to the EPA administrators, I think, for, at least since about 2020, if not before then, and to many politicians. Listen, the two individuals who wrote the foreword to our book are Congressman Gus Bilirakis, whose brother died from Parkinson's disease, whose father has Parkinson's disease, Republican from Florida, and Congresswoman Jennifer Wexton, who developed a rare form of Parkinson Parkinsonian disorder called PSP, and she was so disabled that she had to step down and not run for re-election in 2024. This is a nonpartisan issue. Parkinson's doesn't care if you're a Republican or Democrat. Quite frankly, doesn't care if you're a capitalist or a communist. This disease is rising rapidly. It's rising in all parts of the United States, and it's rising throughout the world, especially in the areas of the world that are undergoing most rapid industrialization, like India and China. If we take action to prevent people from getting exposed to this disease, we create a world that is likely what 99.9% of human history, where Parkinson's was extraordinarily rare. Only rare ancient descriptions of the disease. It's only in the first major description of Parkinson's wasn't until 200 years ago by Dr. Parkinson, who said the disease had not been classified in the medical literature. It, like lung cancer, is a new disease. And we can say goodbye to these diseases. We can say goodbye to lung cancer by stopping smoking. We can say good to a lot of lung cancer by stopping smoking. We can say goodbye to much of Parkinson's disease by cleaning up our environment.
Well, Ray, sometimes when there's a very well-known figure from media, entertainment, politics with the disease, it brings public attention to it. And I think we had a researcher from the Michael J. Fox Foundation on our show. And Michael himself, I understand, believes that his case was caused by chemical exposure. How do most patients react to your writing? Do you hear from patients saying, "Now I understand," or what's the response that you get when they hear about this?
So first of all, we should be, in the words of Michael J. Fox, Parkinson's sucks, and it's really hard to bear the burden, and it's really hard to be the face of disease. So we should thank people like Michael J. Fox,
right,
like Brian Grant, like Davis Finney, for their service, and for Michael, in the case of Michael J. Fox, for 30 years of being the face of the disease, because he brings attention to it. He's reduced the burden of the disease for millions of people across the world, raised funds for research. So we should thank these public figures when they do come forward. My inbox is filled every day. I got an email this morning from connecting me to someone who was a first responder at 9/11, a firefighter who developed Parkinson's disease, and evidently has friends and colleagues who also have Parkinson's disease. We're doing a nationwide listening tour that's taken us to 25 cities and 15 states. I met a woman in South Dakota. Her job as a teenager was to raise a flag to tell the crop duster where to spray the pesticides on farms as a young girl. Met a man in Dallas, Texas, who had the same job. Met people in West Virginia who worked in chemical plant, but he worked in a white collar job. And then he told me later, after hearing me talk, that he loved to degrease cars and was likely using trichloroethylene as a teenager. In the book, we talk about Brian Grant, who is a 3-year-old boy at the Marine Base Camp Lejeune when his father, a Marine, is stationed there, and he's likely being exposed to these chemicals. I think one thing that we're learning is that, this resonates. People are giving, I think, answers to what causes their disease, which lets them take action to slow the rate of progression, lets them take action to prevent their kids and grandkids from getting the disease. And if we know what the causes of disease is, for those who want to cure Parkinson's disease, the prerequisite to a medical cure is knowing its cause. And if we know what its causes are, we can more readily and faster develop treatments for Parkinson's disease. The other thing I'd like to emphasize is that I think that the seeds of these diseases are planted young. You don't develop lung cancer at age 60 because you started smoking cigarettes at 58. You develop lung cancer at 60 because you were likely smoking at age 20. I think in many people that we've been listening to, that the seeds of the disease are planted early, sometimes in your 20s, when, like the Marines at Camp Lejeune, or sometimes when you're a young child, or even possible in your mother's womb.
Well, thank you, Dr. Dorsey, for joining us. Your book with co-author Dr. Michael Okun is The Parkinson's Plan. It's published by Public Affairs. And we want to thank our audience for being here. Just a reminder, please be sure to subscribe to our videos on YouTube, find us on Facebook and X, and please share your thoughts and your comments about this program. Take care and be well.
Thank you very much. If people have questions about Parkinson's disease, they can just email me at info@pdplan.org, info@pdplan.org. And the book is available for purchase on Amazon or in your library or wherever you like to get books.
That's wonderful. Thank you for taking the time.
Thank you so much, and thank you for your work. This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.